Hello and welcome back. I hope that you have learned something useful and that this information sets the foundations for your success. Here we're going to focus on clinical examination. This is not going to be in depth of all the examination for all systems, but it's more an overview and some tips. So you do your best in answering the task and of course, conducting the physical examination or requesting the findings, depending on what you are being asked. So now for the online format of the exams, the criteria for assessment and what the examiner is expecting from you, it remains the same as in-person examinations. I know it's totally different to do telehealth. However, telehealth is now booming with all the COVID, and a lot of doctors have to move into this. So it's not something new. It can be done. Of course, it's different from having a patient in the same room, but it's possible, and you need to have in mind and follow a order so you're able to gather the information that you need. Physical examination stations, as I have mentioned before, will be 5 or 10 minutes in total, and you will get the time stated very clearly. If it's 10 minutes, you will get 2 minutes reading time, and if it's 5 minutes a scenario or an station, you will get 1 minute reading time. So always follow the tasks and do them in order. For this, you need to exhibit a clinical reasoning, interpretation, and understanding of all the techniques and the process of examination. For the online format, you will be requested to ask the findings from the examiner. So the same as I say, follow an order. I found really good the videos from Geeky Medics that you can find on YouTube. And the same, Tyler O'Connor has a list and the procedures, same as Geeky Medics, a list of all the things that you need to focus for each system examination. For the online, just practice with other candidates to get familiar with the format. Visualizing having the patient in front of you and ask yourself or practice with a colleague, what do you need to check based on this history? What's the diagnosis in mind? And what are the signs that you are expecting? Always include bedside tests if they are appropriate. And of course, you will need to focus mostly on a exam of, yes, you cannot examine the whole patient, but focus exam. So it depends on the tasks that you are being asked. It's always great way to open this part and the requesting findings for examiner, explaining and saying, I would like first to get the physical, the general appearance of my patient. Is my patient alert, lethargic, looks toxic, unwell, or ill? If there's any, just very by inspection, pallor, cyanosis, jaundice, does the patient have difficulty breathing? So all this can he or she speak in sentences? All this will help you to know exactly how unwell is the patient or not, and what to expect or what else to look for. Can I please have the vitals of my patient? What's the pulse rate and rhythm, respiratory rate, the blood pressure? Is there any changes or postural drop, oxygen saturation, and temperature? It's one sentence, but it's very important that you always ask for the vitals of the patient, regardless of what you are being asked. If you have suspicions or you are thinking of some medical conditions, remember them and what are you looking for. For kids, always check the growth chart, the head circumference for babies, if they are hydrated. So is the kid crying? Does he have, tears? How is the mucosa, oral mucosa? All those little things will give you the good information. If you are being asked to conduct a focus examination, you can make a statement, which I learned, and I think it facilitates things and tells the doctor that you would like to do a lot of examination, but you can't. So you just say, I would like to do a complete head-to-toe examination in my patient, but for the time limit, I will now focus on this and just request the findings from that system. Or if you are doing only one area, one extremity or something, just focus on the joint or the part that you need to examine. As I say, request for that, and then include the bedside test if you need. Some of the basic tests that are generally done here as a routine are glucose, the urine dipstick, the electro, and also spirometry. So follow the same principles. Always start with inspection. Take time to inspect, and that's from head to toe what you are willing to know about the patient. Palpate, feel, percussion and tapping, auscultation, listening, and if it's more the orthopedics, if it's you need to assess a function or measure if there's discrepancies left, right, all included there. It's always the focusing on the order and to make sure that you show the examiner that you know what you are doing. If you have the patient in the room, always ask for consent to examine and tell them what you are going to do. Make the patient put in a position that is best for you to examine, expose the area that you require, wash your hands before and after, and ask them if there's any pain, you will be able to stop, or just to please let me know if there's any pain. So for women health, teenagers, or if you're doing an examination of genitals or anal areas, it's always best to have a chaperone and just request, I would like to have a chaperone for this. So it's just a statement, but it will help you to perform better, to tick all the marks that the examiner is wanting to see. System examination, the same for focal area examinations. Refer to all the geeky medic videos, which I find really good. I have created for my studies, I recorded myself, because you need to do, the case is 8 minutes, but you need to do the system examination in 6 minutes to then be able to have a summary to the examiner or present your information. So I did all the scripts for all system examinations and also for some focal areas, and I have them now available for the other doctors as under the full clinical summaries. I find them super helpful because it's just repetition and repetition, and the more you listen, the same with a song. You listen to a song once, you won't remember, but if you listen to every day multiple times, you will be able to sing in a week. So the same with this, the more you listen and the more you have clarity and the order, and you know how to ask for things or how to do examination, it will come very easy and autopilot. So thank you for watching. If you're interested, explore the full course that I have, where you get all the scripts, audios, and great information. Thank you again for watching. Bye. We'll see you in the next.